baseline scan, day 2 scan, first scan. Why is everyone talking about ultrasound scans for an infertility patient? I, Dr. Parrul Aggarwal, would like to throw more light on this. The baseline scan, the day 2 scan, or the first scan is a very important scan with respect to a female patient who is seeking for infertility treatment. When she visits a fertility specialist, the fertility specialist will do the scan to understand what is the pathology in the pelvis that the patient is not able to conceive. She will look at the uterus or the womb to find any pathology there. The pathology could be a polyp, a fibroid, a space occupying lesion, or any abnormality of the structure or the genetics. Then the fertility specialist would look at the ovaries. The problem could be in the ovaries as well. There could be any pathology in the form of any cyst or endometriotic cyst, or could be dermoid cyst. Also, the number of follicles are being counted on the day 2 scan, that is the baseline scan, to see how many eggs can be retrieved at the end of the fertility treatment. Plus, the tubes, which are the fallopian tubes, if have any pathology in the form of hydrosalpinx, any tubo-ovarian mass, any tubo-ovarian abscess, can be looked in the ultrasound scans. Additionally, any pathology in the surrounding structures in the pelvis can also be seen in the same baseline scan. So a baseline scan is very important for a fertility specialist to know what is going on inside the pelvis in that particular female patient. So let's look at the patient on the screen. The patient is made to lie down after emptying the bladder, although a little bladder is filled here. Then we look at the uterus. Any pathology in the uterus is seen, should be noted down. The lining of the uterus is evaluated and is measured. Then we look at both the ovaries one by one. We are here looking at the right ovary, and we will look for any pathology present in the ovary. This is the right ovary, and we will count the number of follicles, which are the future eggs for this particular patient. Similarly, we will look at the other ovary. This is the left ovary, and we will count the number of follicles in this particular ovary. And we will look for any pathology present there. After this, we have to sweep from right to left, from above to below, and from anterior to posterior, covering all the pelvic walls to look for any pathology in the pelvis. This covers the entire baseline scan or the day 2 scan or the first scan, which the fertility specialist is always asking for. Hence, I believe that this knowledge was extremely useful for you to understand why a fertility specialist emphasizes on a baseline scan, a day 2 scan, or the first scan for a female patient. Thank you.